And good morning. I'm Dr. Deuk, CEO and founder at Deuk Spine Institute here. I have a patient who came to us with severe, debilitating pain coming from below his spinal fusion in his lower back. He had sacroiliac joint pain on both sides, and there was no getting rid of it. There's only one treatment that works, and it's the Deuk plasma rhizotomy offered here at Deuk Spine. It's now patented and it's FDA approved. His insurance approved the procedure. He had it done yesterday. How do you feel today?
Great. That 99% better than I felt 2 days ago. Not kidding you.
And are you on pain meds?
No, I'm not.
Do we put you on some new meds that took away your pain, or is this from the procedure we did?
This is from the procedure.
And we did it less than 24 hours ago. Here you are back here. It was outpatient. Your pain is gone. You're not on any medication. There was no bleeding, no hospitalization necessary, and 2 tiny little 4-millimeter punctures on the skin. You happy?
Oh, absolutely. I'd give you a kiss if I liked you.
You like me.
I
You
know
already
I
gave me
do.
a hug.
I know.
Kisses are off limits. My wife is the only one. My kids. That said, I've known you for a long time.
Oh.
We did your fusion many years ago. Because of the fusion, you wore down those SI joints pretty quick. So that's why we had to do your procedure. Very common in patients with fusions in their backs, they get what's called adjacent segment disease. And what that means is when you fuse a part of your spine that's meant to be bending and twisting, then that puts strain on other joints above and below, and they wear out faster. We do not recommend fusions on anybody, or laminectomies or discectomies, because they lead to fusion. We did your fusion many years ago.
Oh, yes.
Your insurance did not want to do the laser. They only wanted to do the fusion, so we did it. And now we're dealing with some of the sequelae of that, right?
Yeah, workman's comp was tough.
And people say work comp patients don't get better. Is that true?
Oh, no, depending on what doctor you have.
That's right. And what treatment you have.
Yeah, absolutely.
If you have the right treatment, work comp patients get better. Isn't that true?
That is absolutely true.
Is there anything you want to tell your fans out there?
I'd like to start out by telling you in 1982 is when I first had this situation happen during a 5-car accident. And I've been living with pain forever, seemed like. Today I don't have any pain. I mean, I just don't feel any pain. That's how far I've come, along with this man, of course. Without him, I don't know what I'd have done or what I'd done. One nurse one time gave me go see Dr. Deuk. He's the best. Well, he is the best. Thank you.
You are why I do what I do, to
Thank
help
you.
people just like you, suffering, to try to give you some decency and quality back to your life.
Even all the complaining, I said, I don't want it, I don't want it, I don't want it. You kept talking me into it. I'm glad you did.
You're
I'm
welcome,
glad
my
you
friend.
did.
You're welcome. Enjoy your life.
Oh, I will. And you too, huh?
Thank you.
You're a good guy.
Thank you. I appreciate it. All right, let's get you out of here.